Good afternoon to members of the media and the people of Bermuda. I'm grateful to be joined this afternoon by the Minister of Health, the Honorable Kim Wilson, for today's press conference as we kick off a series of briefings and engagements by ministers on the 2025-26 budget and the key initiatives their ministries will deliver in the coming year. On Friday, the 2nd of May, the government delivered this year's budget in the House of Assembly. The statement was more than just a financial update to the country. It was a statement outlining a continuation of the government's plan that was in line with our values of fairness and equity. In the last fiscal year that ended, Bermuda achieved its first consolidated fund surplus in over 2 decades, closing the year with a $19.7 million surplus. This surplus is $19.5 million more than was projected in February last year and has been delivered through an economic plan that has cut taxes for workers and small businesses while ensuring that everyone in the economy pays their fair share. Now there will be those who will cast doubt on this government's economic record, but they cannot and should not ignore the facts. Real GDP growth in Bermuda is outpaced the United States, United Kingdom, Canada, and in 2023 was the highest in the Western Hemisphere. Unemployment is at its lowest level in 50 years, registering at 1.6%. Employment income has risen 8% year over year to more than $4.3 billion. And inflation, which has devastated household budgets in many countries, has remained the lowest of our peers and dropped below 2% last year. This is a result of our targeted tax policy that has frozen fuel costs, has reduced electricity costs, and also, at the same point in time, has frozen the standard premium rate for 3 years. On the expenditure side, we stayed firmly on target. Current account spending for last fiscal year was $992 million, just $128,000 above the original estimate. This is especially noteworthy given our consistency in reducing taxes for workers and businesses and the allocation of $17.6 million during the mid-year budget review specifically for current account expenditure. Our current account expenditure also includes the cost of salary increases for public officers following a multi-year agreement with public sector unions. And so this is a clear example of how we can meet our obligations to our people, honor our labor agreements, and still exercise strong financial control. Is our economy perfect? No. Are there still people struggling? Absolutely. Do these statistics mean that everything is perfect? No, not at all. But they confirm that we are moving in the right direction and performing better than other countries during an uncertain time for the world. This budget also makes significant investments in our public services, social spending, and infrastructure. Most notably, as the Minister of Health will discuss today, we've allocated an additional $45 million of increased funding to the Ministry of Health, supporting the implementation of universal health care, the expansion of HIP and future care coverage, increased prescription drug benefits, and also increased funding to the hospital. We will make additional investments in social programs throughout the government. Following from the mid-year review, all those funds have carried over to the new year. But in the new budget, we've also allocated a new round of grants for community and sporting clubs, as well as funding for the MIRRORS program, the Dementia Care Pilot Program, rental assistance, individual family counseling, interventions and educational programs through the Gang Violence Reduction Team. We will also invest in our infrastructure with the largest capital investment program since 2008. $149.8 million, which represents a $37 million increase over the previous year. This year's capital budget includes $17 million for the Bermuda Housing Corporation, $13 million for the upgrade of Tynes Bay Waste-to-Energy Facility, $8.8 million for new buses and ferries and pilot boats, $6.4 million for essential hospital upgrades, $6.3 million to the Ministry of Education for educational facility improvements, including signature schools and parish primary schools, and additional funds to upgrade IT infrastructure at our schools, $6.3 million for government and IT digital infrastructure, including cybersecurity and online services, $5 million for road-wide road paving, and $4 million to begin the replacement of the Swing Bridge. These investments represent a deliberate strategy to strengthen Bermuda's physical and digital infrastructure, improve service delivery, and ensure that the island is well positioned for continued long-term economic and social resilience. And we are continuing to deliver targeted tax relief that benefits working families and businesses to address the cost of living. We are reducing customs duty on mall building materials to a flat rate of 10%. So that means that some rates are coming down from 35% to 10%. We're eliminating customs duty on the importation of motor vehicle parts. There's a further reduction on fuel duty. Last year we cut it by 60%, and this is what goes on electricity bills. This year we're cutting it by a further 20%, meaning that over the last year we will reduce this tax by 80%, which will save families, the average household, $300 a year on their energy bill. A 50% reduction in monthly tax on mobile phone bills from $12 to $6 a month, an increase in the duty-free allowance from $200 to $300, the first increase for returning residents in over a decade. In addition to this, these changes which I just outlined will come into place on the 1st of July. But in addition to those changes, as the 1st of January, the base rate on land tax will reduce by 50% from $300 to $150. And on the 1st of April 2026, the government will make further reduction, such as the reduction in private car licensing, which will go down by a further 10%. And this follows the reductions that the government made a couple of years ago. The combination of these reductions will save an average family $1,000 a year. And this, of course, is on top of all the reductions in customs duties, payroll taxes, and other fees that we've made since 2022. This government is delivering on our promise to continue to reduce the tax burden, and we are delivering progress for Bermuda. Now, those are the general statements on the budget. Before I hand over to the Minister of Health, I do want to speak specifically to the budget for the Cabinet Office. The government will allocate $53.6 million to the Cabinet Office, which is an increase of $4 million. This additional funding is support. Most of the increase, an additional $975,000, will go to the digital transformation team to improve online services throughout the government while making more use of artificial intelligence to improve service delivery to residents. There's the funding boost for government IT services under the Department of Information and Digital Technology, including a record capital investment of $6.5 million to enhance reliability and improve cybersecurity. There's additional funding for the Department of Planning, and also we're going to expand the public service bursary program to make higher education more accessible in return to service to the government following graduation, which is delivering on one of the key platform promises made in the Progressive Labor Party election manifesto. These additional investments on the Cabinet Office are laser focused on improving the delivery of government services while investing in training and development for the future of the public service. When I presented the first Progressive Labor Party government budget nearly 7 years ago, Bermuda was burdened by austerity, chronic deficits, and declining confidence. Immediately, this government began making taxes fairer by cutting tax for workers. But just as we're seeing the results of our work, a once-in-a-century pandemic challenged everything, something the Minister of Health knows very well. Our economy, our healthcare system, and our collective resilience. But through it all, we made tough but necessary decisions and provided the strong leadership that our island needed through those unprecedented times. We protected jobs, safeguarded public health, and chose people over politics. The data in this year's budget speaks for itself. We are not where we were. We are no longer in recovery mode, and the progress is here today thanks to this government's sound economic and financial management. We are stronger, more stable, and well-positioned for a brighter future. Yet, there is still more work to be done to ensure that all Bermudians feel the benefits of what's being done, and this government is committed to continuing doing this work. I now hand over the podium to the Minister of Health to highlight the critical initiatives from the Ministry of Health in this budget. Minister.
Very small podium. Good afternoon, everyone. I'm pleased to share the key highlights of the 2025-2026 budget allocation for the Ministry of Health. The ministry consists of 4 departments: the Ministry of Health Headquarters, which encompasses corporate services, administration, and the Office of the Chief Medical Officer, the Department of Health, the Health Insurance Department, and the hospitals. The Bermuda Health Council also falls under the Ministry of Health as a quango. Guided by its vision, the Ministry of Health remains committed to fostering healthy people in healthy communities. The budget of $116 million has been allocated for the 2025-26 financial year, and it includes $177,141,000 in funding for King Edward Memorial Hospital and the Mid-Atlantic Wellness Institute. This represents an overall increase of $44,998,000, or 22%, compared with the ministry's original budget allocation in 24-25. The Ministry of Health's estimated revenues for 25-26 is $3,782,000, and this is consistent with the prior year. This year's budget reflects our dedication to ensuring quality, accessible, and affordable health care for all, with an additional $56.3 million allocated from the Consolidated Fund to support this critical endeavor. These funds will significantly enhance Bermuda's healthcare infrastructure by allocating an additional $22 million to the Bermuda Hospitals Board. This investment will support the hospital in its continued delivery of high-quality healthcare services, ensuring excellence in patient care across our island. As we accelerate and the implementation of the universal health coverage ahead of its full launch in 2026, Phase 1 of UHC is backed by a $13.25 million investment, delivering immediate benefits to HIP and future care policyholders. And these enhancements include the following. 1, annual health exams. Promoting early detection and long-term wellness is definitely critically important, and I'm sure we'll all agree to that. And we are proud to introduce and expand coverage for annual health exams for all HIP and future care clients, completely free of out-of-pocket expenses. This transformational initiative ensures that every resident under these plans has access to a yearly preventable health exam, which is empowering individuals to take charge of their well-being and detect potential health concerns early. By prioritizing prevention, we are strengthening Bermuda's healthcare system, ensuring that essential care is never a financial burden. Healthcare should be proactive, not reactive, and this initiative makes a bold step towards a future where well-being comes first. Second, we are expanding the prescription drug coverage benefit. This year's healthcare investment marks a significant step towards HIP and future care's further support for those policyholders with enhanced prescription drug coverage. While access to medications has many Bermudians, especially our seniors, continue to face financial barriers in obtaining the treatment that they need. This additional funding will provide meaningful relief by increasing the HIP coverage limit from $1,000 to $3,000 per year and raising the future care limit from $3,000 to $5,000 per year. This expansion ensures that more individuals receive the care that they deserve, reducing the financial strain on families and promoting better health outcomes across our community. And number 3, elimination of the 12-month waiting period for the personal home care benefits. As the Minister of Health, I have heard and listened to the concerns of the community, especially from families caring for loved ones at home. So today I'm extremely proud to announce on behalf of the government that we are taking decisive actions. We are eliminating a 12-month waiting period for new HIP and future care policyholders to access the personal home care benefit. This is a transformational change for families and seniors across Bermuda. It provides immediate financial relief, supports aging in place with dignity, and helps to reduce hospital readmissions and healthcare costs. Previously, newly enrolled HIP and Future Care members faced a year-long wait period before accessing these essential benefits, even in urgent situations. That barrier will soon be a thing of the past. With this policy change, families will receive the care and the support that they need right when they need it. Because when it comes to health and well-being, every moment matters. These critical measures strengthen healthcare accessibility, enhance patient outcomes, and lay the foundation for a more inclusive, sustainable healthcare system for the future. Universal health coverage and universal health has long been our goal as a PLP government, but goals alone do not build a strong and sustainable system. This transformation requires careful planning, robust investment, and a firm commitment to minimizing disturbances for those currently insured, uninsured, or underinsured. We must ensure that this transition is smooth, effective, and beneficial to all. I'm also pleased to share that $3 million of this additional funding will be allocated to accelerate the process of this initiative in the lead up to full implementation of UHC in Q3 2026. Furthermore, last year our government took decisive action to shield residents and businesses from a mandated premium increase by utilizing funds from the excess borrowing account. This freeze of the standard premium rate for the third consecutive year in a row helped to safeguard families and employers from additional financial burdens during a period of global economic uncertainty. This year, we are moving beyond freezes, and we are investing in the future of Bermudian health care. We are strengthening the benefits available for the people of Bermuda, ensuring that health care is not a privilege, but a right. Health care is about people, about ensuring that families, seniors, and individuals have access to the care that they need. But we must also safeguard the sustainability of our healthcare system. With global medical inflation expected to exceed 10% this year, the rising cost of medical care, equipment, and pharmaceuticals present a real challenge. To continue providing essential benefits and maintaining adequate funding for the Bermuda Hospitals Board, an inflationary adjustment to the standard premium rate will be necessary. While this decision is not taken lightly, with the well-being of our community in mind to ensure that quality health care remains accessible, resilient, and properly supported for all who rely on it. Before I conclude today, I want to reaffirm the urgent need to strengthen Bermuda's healthcare system. A robust and well-structured system is not just a necessity. It is the foundation for better health outcomes, greater efficiency, and a future where quality, affordable health care is accessible to all. While the current costs of health care remain high, they do not yet align with the health outcomes that we deserve. This is an opportunity for meaningful change, and we are committed to ensuring that Bermuda's healthcare system evolves to meet the needs of every individual, both now and in the years ahead. Our initiatives in the coming legislative session will drive meaningful improvements in health outcomes, reinforcing our commitment to healthy people in healthy communities. With bold action and dedication, we are shaping a future where every Bermudian can access the care that they deserve, a future of strength, wellness, and opportunity. And in keeping with the health reform, we are strengthening our system, creating access and equality all. And this is the healthcare future that Bermuda deserves. Thank you.
Thank you so much, Minister. Before I close and open for questions, I would like to take this opportunity to extend my deepest and heartfelt condolences to the families mourning the loss of their loved ones due to the tragic and disturbing events in Somerset over the weekend. Minister Weeks, MP Bean, and myself did visit one of the families over the weekend. I know the Minister and MP Bean also visited the other families over the weekend. In the days ahead, ministers will share the specific initiatives funded through the health, housing, infrastructure for the vulnerable. This government does more than balance the books. It balances Bermuda's priorities and what we must do today to build a fairer Bermuda for tomorrow. Because this budget is fairness in action, fairness is how we tax, fairness in how we invest, and fairness in who benefits. Thank you, and look forward to your questions.
Good afternoon, Mr. Burt.
How you doing?
All right. Let's have a question based on a statement issued on Friday from the opposition about the economic growth, which they said was being credited to the government rather than the international business sector. How do you respond to that claim, sir?
So I'll start by saying this, Alva. I would really hope that we could focus on the government's budget, what we've actually said, rather than the opposition, who will have their day on Friday. And you can report on all of what the opposition writes in their reply on Friday after they deliver their budget reply. The budget cycle works that the government delivers its budget and the opposition gets a week to prepare their reply. And I think it would be more helpful to have that conversation discussion after they have delivered their reply. But to go to the basis of your question, it is remarkable that the opposition, who spent so much time trying to blame the PLP for everything and basically stating that the Progressive Labor Party would damage international business, gives the government zero credit for maintaining a strong international business sector. In 2017, it was the first round of Trump's tax cuts, would mean the end of international business in Bermuda. In 2018, it was economic substance from the OECD. That would mean the end of international business in Bermuda. Remember the conversation is whether or not people will still be working in Bermuda, whether or not they'll all be remote in other places. And then it was corporate income tax, and whether or not we would implement this and companies would leave. What have we seen on corporate income tax? We have seen more companies come to Bermuda due to the way in which we have implemented this global agreement. Since the pandemic, we have seen job growth in international business to the point where it is now a record number of jobs in international business and also a record number of Bermudians in international business. The reality is that it is because of this government's sound economic management, working with the private sector and with the regulators, continuing to promote Bermuda's international business sector overseas, that we have seen this growth. And I bet your bottom dollar that if the international business metrics were moving in their way, it would be our fault. You can't have your cake and eat it too. You must give credit where credit is due, and the opposition should focus on their particular plans rather than trying to say that the progress that this country has had does not belong to the government. It is a nonsense.
It's coming from a statement as well that we issued on Friday from the opposition. It has to do with the dementia care programs. It was suggested that such programs should be placed under the Ministry of Health's mandate rather than the Ministry of Youth and Social Development.
Well, to be honest, I, like the Premier, will wait until Friday to hear the actual reply of the opposition. But in any event, this is a joined-up government, and oftentimes we see initiatives that cross or straddle, so to speak, various ministries. So it's not unusual for dementia care and that pilot program to be led by the ministry that's responsible for seniors, but both ministries sit at the cabinet table. So as a joined-up government, those discussions, insofar as advancing initiatives such as those that are important for our people and persons that are suffering from dementia, it's not unusual for that to be the case where discussions take place at the cabinet table and one ministry may take the lead. Not unusual at all.
Okay, and one more question on healthcare. The programs that the government has in place over the next fiscal year, how many programs cater for those persons who are not insured, who are not covered by insurance?
Thank you for that question. As we've indicated, the goal is for universal health coverage to be implemented in Q3 of 2026. However, in the interim, persons that are underinsured are able to avail themselves of applying to the HIP program, the government program, which is the health insurance plan, or alternatively, if they are unable to afford health insurance, then there are avenues that are available to them through the Department of Financial Assistance, which will also cover insurance, so that if there's a gap that exists in an individual, we don't want them to fall through the gap. So therefore, if they are unable to pay for their insurance, then they can apply for the Department of Financial Assistance, who
Hello, good morning, Premier, or sorry, good afternoon, rather, and Health Minister. I guess if I may start with health, the standard health benefit, that's due to increase. Do you have a figure of how much people will be paying more?
Not at this point. It's too early to indicate. We do note that, like I said, the overall medical inflation rate is over 10%. We also recognize that part of that calculation will require us to do an assessment on utilization. So there's a number of factors that will have to go into that for us to make that assessment. And then, of course, Cabinet will have to approve that. But there are a number of issues, and we're just doing the work. So there's some work that has to be done before we're able to announce any further details surrounding that.
The Premier had said that the deferral saved paying taxpayers more than $500 per year. Do you expect it to be around that figure in terms of savings?
Again, it's too early to say. That would have obviously dealt specifically when we froze for the third year in a row the SPR. But we don't know what the extent of the increase of the SPR will be because we have to do that work. And the modeling has to take place as well as we have to factor into things such as utilization.
Thank you for that. So the personal home care benefit, that's being eliminated for the 1-year wait period.
Correct.
Why was that wait period in force in the first place?
Well, there's a number of reasons. Part of it was sustainability because, of course, whenever you add a benefit, you have to also cost out that benefit. So for every X number of dollars increasing a benefit, it would also require an increase in the premium. So it was largely due to sustainability. We recognize that it's a benefit that many, many individuals were looking to be able to avail themselves of. We recognize that there's an increase in the aging population. We want to keep people living longer at home and aging in place with dignity. So we did hear, I've heard a number of persons that would contact me because they weren't able to avail themselves of that benefit because of the 12-month waiting period. And then the government took proactive steps to ensure that the financing that was required to increase that benefit and remove the waiting time was provided. So we're really, really excited about that particular initiative because we know that it will benefit many, many Bermudian families.
Do you have a roundabout cost or an idea?
No, not that. Everything that costs out has to be modeled. So we have to model that based on what we anticipate the utilization will be, what we anticipate the numbers will be. But the information, I guess at the end of the day, the man to my right provided us with the financing, so we'll be able to provide that benefit.
So additional funding is going to go towards the BHB.
Yes.
As we know, we've seen issues, complaints about staff wages, which haven't risen. Also 90 beds currently at King Edward. Do any of these infrastructure rejigs, will there be dedicated funds to increase the space for bed capacity at all?
Well, the additional funding to the BHB, you'll know that they are on a block grant, and we are not involved as the government in the operations of the BHB. An additional $22 million will be provided to the BHB for their operations, and it's a matter for them to obviously utilize those funds in an appropriate way in accordance with what their operational needs are, as well as their mandate under the legislation.
Would you support the idea of increasing bed capacity?
I'm not so much sure it's an issue of increasing bed capacity, so to speak, because there's a finite footprint where they exist. However, I recognize, as we've spoken about before, regrettably, there are some challenges that we have, very complex challenges as it relates to bed blocking and the like. But insofar as an extension of the bed capacity, they do have a finite footprint. But I would like to add, though we did receive funding through the capital budget with respect to, A, ensuring that we're able to provide further enhancements to Sylvia Richardson so that we can increase their bedding. And B, which I'm really excited about, is that we've started through the Ministry of Public Works a initiative that will help to design the next Leafroy House. So there's an ongoing competition now with the architecture firms for them to design the new home. The third thing I think is important to note, that notwithstanding the fact that there may be challenges as it relates to persons that are currently in hospital, many of those individuals require somebody to help look after them during the day. And you'll know that the government has committed to converting Gilbert Institute into a day facility that will allow persons to be removed from the hospital and know that there's somebody that can care for them during the day whilst their family members are at work.
Thank you very much. Just lastly, the Mangrove Bay Medical Clinic, do you have an update on that at all?
I trust and believe. We've been pushing for that in the West. No, but we are we're working in conjunction with the Ministry of Public Works, because obviously they'll be the ones that are dealing with the work aspect. There will be more information to be announced in the very near future. We'll just leave it at that. But we're very happy for the residents of the West End who will finally get their clinic back.
You expect it this fiscal year?
Oh, I'm hopeful, yes.
Thank you.
Thank you.
If I can turn over to the Premier.
Yes, ma'am.
Thank you for your comments. So you mentioned in the budget there were several tax proposals that will be delayed and outright canceled. What was the decision behind this?
I don't think I said anything would be outright canceled. What did I say would be outright canceled?
This relates to, I believe, tax provisions on those who are elderly or aging.
Okay.
Retired.
No, the budget statement did not say that those are outright canceled. The budget statement said that we are going to review those policies to make sure they are right. Sometimes in the examination of those particular policies, there was a need to make sure that we got them appropriately, I guess I'd say targeted, to make sure there was not excess leakage. So on that side, on the one with the dividends, which was something that we did want to say, to increase the dividend threshold where persons were paying tax, we did look at that. And in our discussions, there's actually some challenges with the overall dividend system, which we put in place in our first budget in 2018. So we're going to look at that because we have had news reports come to us that people who should be paying that tax are finding ways to duck that tax. So rather than expanding it, we need to make sure that we fix it to make sure that persons are paying their fair share. It is something we put in place in 2018, but it would not be correct to say cancel them altogether. They are something, the payroll tax on those over the age of 65 was in our election manifesto. It will be delivered. We just want to make sure that it is done in a right and proper fashion.
And so the proposals that are delayed next year, I believe, is land tax reductions.
Land tax is a biannual item. So rather than saying that we're going to change it July 1st when bills are going out, we decide to push that to January 1st just to make sure that there is no confusion insofar as the timeline, insofar as implementation on vehicle licensing. That is being delayed until April 1st, 2026, but we'll pass the legislation this year. Why is it? Well, when we want to make sure that we had enough money for healthcare. We wanted to make sure we have enough money for certain items, and we're responsible when it comes to budgeting. And so let's be clear, it is not as though if we have not cut a significant amount of taxes across the board. This is the first government in history to reduce vehicle licensing. We did it before. And so I'm sure that citizens will understand if that is not coming to place into July 1st, but it is going to be legislated for April 1st. I'm sure they will still be grateful and thankful that the first government to reduce it is now reducing those fees again.
Just speaking to folks, they're going to see their health insurance go up. They're going to see pensions for public service workers, their contributions go up. This election campaign was based on making cost of living more manageable. How do you justify this rationale now?
Well, I'm not entirely certain when I will say about their health insurance. Yes, the standard premium rate is going to be increased, but I think as the minister did say, look at the significant expansions that are taking place underneath the particular benefits that are going to be offered that will benefit many families. If you are a family that is struggling with the cost of home health care, that is a benefit for you. If you are someone who is not going to the doctor because you may not have the funds for a copay, but now you do not have to have a copay for your annual visit, that is certainly going to be a benefit to you. And so, if you're a senior citizen or someone, because we know lots of employers have their workers and employees on the HIP program, and now you have an expanded health insurance benefit, that will be certainly beneficial for you. At the same point in time, let's look at the slate of tax reductions which we put into place on top of the ones that we've already put into place previously. So I don't believe that is a completely fair assessment. I can understand how some people may get there because they say, well, that tax doesn't apply to me, that may not apply to me, but the broad range of taxes which we put in place does apply to most people in the country. Most people do have cell phones. Most people, are paying land tax, whether you're an owner and or a renter. Most people are relicensing vehicles. Those are the things that we are doing, and we're trying to spread it as wide across the economy as possible. And the total package of tax cuts comes up to about $45 million, which is significant.
Thanks for that explanation. So something stood out to us in your budget statement. You appealed for the private sector to support the BHB, the hospital healthcare. So It was likened to the donations that were made towards building of the acute care wing back in 15 years ago. That was a very specific project, however, and there was a consortium set up to manage it, Paget Health Services, a multi-million-dollar guarantee. So are you asking for donations, or are you asking for an investment opportunity?
I can cover it too. I think the point that I was making was that the government cannot do it all on its own. I mean, the Bermuda Hospitals Charitable raising arm of the Bermuda Hospitals Board. They go out to the private sector to raise funds for investments in the facility. And so when we talk about having the latest and best technology on island, there is a role for the private sector to play. There's a reason why those awards are named after companies and persons. And so it was important for me from the budget statement to reiterate that it is not just government and taxpayers that are a part of this, and everyone has a role to play. So I know the Hospitals Charitable Trust has started its fundraising outreach, and that was just to encourage persons in the private sector to consider contributing to that effort in the exact same way they contribute to the college, in the exact same way they contribute to events like N10, et cetera. It is just a reminder that this opportunity is there to make sure we have great health care and continue to upgrade our systems in Bermuda. Allow me to just say something on the question before. You said that public sector workers, because their pension contributions are going up, would have a decrease in the amount of take-home pay. That is not correct. That is part of the union agreement, and that is the reason why we're able to push forward pension reform for the public sector to remove that unfunded liability. So I don't want that to go unnoticed, because that is not correct.
Thank you. Second to last question. The shadow finance minister accused the government of misleading the public regarding the budget surplus, and that you're essentially robbing Peter to pay Paul by dipping into our reserves to cover healthcare costs. How do you respond?
Well, the first thing is I would say the shadow minister of finance should take a lesson in politics and wait until he delivers his reply for trying to tell people what he may say in his reply. Then people may not listen to it when he actually gives the reply if he's doing everything in advance. But allow me to say this, we have a difference of opinion. And if it was up to Doug Nakuto, he would tell persons that we're going to increase your health insurance rates and not save you the $540 that we did by freezing the standard premium rate for 3 years in a row. The fact is that unlike the One Bermuda Alliance government, who borrowed money for 4 years and ran out of that money in 2.5 years, we borrowed money to cover the pandemic, had better than expected financial results, and were able to use those funds from the excess borrowing account, which was created by the One Bermuda Alliance, to support persons in this community with investments in affordable housing and investments in healthcare. We take a different approach. We feel that if we have funds, what we must do is support persons where they need the support. And in a time when the economy was still in a recovery phase, we felt that that was the best use of those funds. The Minister of Health, I'm sure, was supportive of those particular funds and investments and additional funds that were able to support healthcare in this country. And Doug Nakuto will be able to tell everyone why he did not support that and how he would actually raise people's health insurance costs. We take a different approach. And guess what? That approach was put to the electorate. And the electorate voted for us to return back to government. And we are executing on the pledges and promises of which we've laid out, which are funded. And so we can have that debate over time. But what I will not do is take lectures from the opposition, who will not tell people what they will do, but will try to criticize what this government has done, which has benefited the people of this country.
Just lastly, any expansion to the duty breaks on essential goods this year?
That is something that may come later. I know the Minister of Home Affairs is having a cost of living summit, and those will be conversation discussions. Our platform did commit to the expansion of those matters and essential goods, and we'll see what happens after the cost of living summit. We're not going to certainly run them, and from the Ministry of Finance perspective, I don't want to start laying out those issues. The ministers will come into post, we'll give her time to do her work, and then we'll take it from there.
Thanks for your time.
Thank you. All right. Thank you, everyone. Thank you very much, Minister of Health. And we look forward to continued engagements with ministers over the next few weeks as we discuss this country's budget, which will invest in this country, invest in people, invest in our infrastructure, and build a fairer Bermuda. Thank you.